What I want to talk about today is what we call NeuroMobilization, one of the specialty services that we offer here at the clinic. In some circles it's called neurodynamics, neurodynamics testing, neurodynamics treatment. It's essentially the science behind looking at how the nerves move through the system. Okay? There's a certain amount of stretch, there's a certain amount of gliding that can occur when the nerves actually come out of the spinal cord and down into the arms or down into the legs. And what I'd like to do is show you a couple different things as far as the way we test and the way that we treat these problems here. So Meg is going to actually bring her chin down to her chest. Okay? With this motion itself, there is a certain amount of pull that's going to occur from the brainstem down through the spinal cord, and then we actually transfer it as a movement of the nerves into the periphery, to the legs or into the arms. And we can actually encourage that even more by doing a leg movement. So if we actually move her leg up like this, we're going to be putting a little bit more of a stress onto that nerve system. Okay? We're actually stretching the nerve, and that nerve is sliding through the system as well. Okay? What we're attempting to do with what we call, this is actually called the slump test. The slump test is a way of discerning how irritable the nerve is. So if, for example, she slumps or brings her chin down again, and then she slumps her shoulders forward, that could elicit her back pain. Okay? If it elicits her back pain, it's a good indication that the nerve itself is irritable. Why it's irritable, that's up to kind of special testing, further functional testing that we do here in the clinic. One example of that is actually coming from behind and then unloading the spine. So she keeps her head down, puts her arms across her belly, and I come from behind and actually take some pressure off her lumbar spine by doing what we call manual traction. This is kind of an evaluative form of doing manual traction versus a treatment form that we also do in the clinic. But you come from behind, she's got pain right here that's elicited in this position. Come from behind, deload it, makes it feel better. We're thinking that there's some sort of central component to her symptoms, meaning that there might be a disc that's involved here, or that maybe there's an inflammatory process around the nerve that comes out of the spinal area. So that's one aspect. What we could even do is, as a treatment for mobilizing the nerve, we can actually just have patients sit, maybe head back up, and sit nice and straight again. And this is something, of course, that as your therapist, we're going to discern whether there's a nerve problem, whether there's a disc type of problem, or whether it's a muscular thing. And sometimes the joints in the lumbar spine can be stiff. So these are all different tests that we do to discern one type of problem from another. So when it comes down to actually discerning whether a nerve is stuck, these tests really help us with that determination. All right. So if we determine that something needs to be mobilized, and we want to get that nerve gliding and sliding to either get it moving because it's stuck, or maybe to maintain and release it we achieve here in the clinic, or to just get the nerve moving to try to bring more circulation to the nerve, to try to enhance a healing effect. This is one example to do both, but maybe for different reasons that of course we'll discuss with you when you come to see us. But essentially it could just be sitting straight and just extending, and you sit nice and straight, and then she'd actually, that could be it in and of itself, and back down, just doing repetitive knee extension, flexion, knee extension, flexion, not pushing into pain necessarily. Sometimes you take it to the verge of pain, or kiss the pain and then back down. Okay, so very mild to no pain at all. Then she could actually start adding this component to it. So down and then back up, and yep, back down. So knee, ankle, okay. So we're tensioning the nerve doing stuff like this. You can actually further tension the nerve by chin down. And she can maybe slump doing this, and then incorporate the same thing. And then back up, back down, back up, back down. And this is just a mobilization down and a mobilization back forward. So in a sense you're stretching the nerve going this way, mobilizing, and then releasing and slackening as it goes back up. And then go down one more time. Let's have you extend again. And at the top of the range here, she can actually slacken at the top, maintain this position, and then back off here, and then back down, and then release. And then back up again, and then back up. So slacken, and then tension. Okay? And then, okay, that's, now go to tension, hold that there, slacken, keep your leg up, chin down, tension again, and then slacken again, okay? And that's probably good. So it talks about the whole, the treatment approach, the evaluation approach, and that's stuff that we'll surely talk about when you come to see us. Okay, thanks.